So today's speaker is Mary Kay Chess. A little bit about Mary Kay. She is the Dean of Academic Affairs at Hinnicott University in Seattle, Washington. She teaches systems thinking and complexity, adaptive change strategies and leadership, and personal development in these vibrant learning communities. Dr. Chess also consults with foundations and organizations, as well as their boards, on building the leadership capacity necessary for thriving in our complex world. In addition, she serves as a leadership coach to executives and faculty training teams. She also designs and leads NCHN's Leadership Development Program. Mary Kay held executive roles in rural and urban hospitals and healthcare systems, including Gundersen Lutheran and Kaiser Permanente, sorry if I butchered that word, as well as in shared service networks in medical groups and hospitals. She delights in bringing perspectives from diverse stakeholders to the table to create innovative options and opportunities. Mary Kay lives on an island in the Pacific Northwest, and a ferry is part of her commute time. Dr. Chess also serves as the CEO and board member of the Northwest Institute of Literary Arts, an accredited and low-impact program offering an MFA in classrooms with a water view for inspiration. Welcome, Mary Kay. I'll hand the webinar off to you now.
Great, thank you, and I appreciate that nice introduction, but what's even more important are the introductions of all the folks on the phone. Let me do an invitation to all of you for this conversation today. When we talk about innovation and rural health networks, I think all of you know that sometimes the best ideas come from comments from participants. So I would offer today an opportunity to use the chat box at will, and if you're feeling really invigorated, please feel free to just call in with a comment or a thought. We have a wonderfully sized group to make that all possible, and so I would invite your comments and your thoughts. Well, as Cassie said, what we're going to take a look at today from two lenses, really, is this whole building a culture of innovation. And so before we start, I'm really going to give you a chance to use that chat box because, Cassie, as you move the slides forward, the next slide we'll need is slide number 2, please. The question is to take a moment and to begin to think about and add into this chat box, what is the most innovative idea that has ever emerged in your network? While we're just pausing here a moment, use that chat box and just add in here, what is the most innovative idea that has ever emerged in your network? It doesn't matter that it may or may not have landed, but just what emerged. So feel free to use the chat box. And Cassie, if anyone needs instructions on using the chat box, perhaps she'll make those. Cassie, do you want to give folks instructions about how to use the chat box, please? Oh, there you go. Thanks. Oh, online even. Perfect. Thank you, Cassie. And Suzanne, if you don't mind checking in again, we think we've taken care of the feedback, but we want to make sure that this is a pleasant hearing experience as well as an innovative exploration. So hoping that there's still an echo. Okay. Great. Okay. Wonderful, Suzanne. Good to hear that. Sounds fine. Okay. So now that's the first step of innovation, making sure all barriers are removed and that it's a time for conversations to take place. So we've captured the first important element in creating a culture of innovation, removing barriers like feedback and echoes, in all seriousness. So just very quickly, what is the most innovative idea that's ever emerged in your network? And we're beginning to see in the chat box some voices and ideas from around the country. Great. Asthma prevention. And it just as we post these in here, again, it doesn't matter if this innovative idea has moved and gotten legs and been implemented. What we're looking for is what creates an atmosphere and a culture that allows innovation to move. And the second point is, how might we leverage a culture of innovation for sustainability? And as these ideas are peppered into the chat box, in our short time together today, we'll explore some examples of networks that have leveraged innovation both through stakeholder engagement or communication or an actual product. So you'll hear a scan of 5 networks, and then we'll take a look at some tools. So you can begin to see here that there is just this beautiful range and continuum of innovation that's taking place throughout the United States. Everything from video connections with ambulance services, very, very important and critical for working with physician stakeholders and ambulance driving stakeholders. Sexual assault in rural areas where there are very minimal resources. Looking at mobile offices, great. Okay, so I won't read all of these, but can you begin to see that there is really no ceiling on innovation once we begin to create that culture? It doesn't mean that every innovative idea will be totally implemented and implemented perhaps in this fiscal year, but the fact that you can begin to create a culture that allows ideas to emerge is what's really important. Great. Well, thank you all so much for participating. I see one more coming in here. Oh, great. Laura, thank you. Working with key stakeholders and building collaboration around mental health issues and mental health services is so essential, and we're seeing some very, very creative pockets show up for those networks that are members of NCHN. Great. Well, here we go again. Why is innovation of interest to you, and why is this particular forum presented to you today? And you can take your time and read this overview of innovation, but it's different than brainstorming. Brainstorming is a tool we use in innovation, but it's beginning to look at how do we begin to build activities and programs that allow us a process for thinking and creating. So it's actually the action step. Innovation becomes our action to take brainstorming and ideas that might emerge or land on a board table when you're having a board meeting. So that's what we're going to begin to explore here. The other thing that I want to stop and ask you about putting into the chat box, unless someone feels very, very comfortable joining in the conversation, is there, or let me rephrase the question, who creates innovative thinking in your network? Just go ahead and put either their position in the chat box. Who is it? Is it a community member? I don't want to pepper you with ideas if you're going to have them. But who is it in your network that generally comes up with the innovative ideas? Just go ahead and tuck those in there. And by the way, it's fine if the answer is you. So if you'll go ahead and jump in that chat box, and let's begin to see, so who's responsible for generating these ideas? Great. Team. Suzanne, I'm really fascinated and would love to have us all have time to hear your network that comes together to think about telehealth, because that can have so many channels for areas of interest. So how do you take a wild scope and brainstorming ideas and move it into action? Perfect. Amanda, you've landed on what I consider, and by the way, it's just my mental model and my perspective, that everyone who's involved really contributes to innovation. And it's our opportunity as leaders to make sure that innovative ideas are really heard. We often know, and I'm just going to digress for just a few minutes and just and be very transparent and tell you that as an educator, one of the primary lessons I've learned is that we all learn in very different ways. Some of us process information externally, and we bounce from idea to idea, and we're just really invigorated by talking about ideas. And so that's, if you're the staff person or you're the executive director for a board, you know that you have innovative ideas because they've been articulated around the table. But we have another pocket of innovative ideas, and those are from individuals who are processing ideas internally. They have, if you looked at their mind, they have dots that would fill a room, and they're connecting these dots with such rapid force that you would be astounded. And so our challenge is, how do we get the quiet connecting of dots along with the verbal ideas and create this a culture of innovation? So that's our challenge today. That's what we're going to be about. I also want to pick out that and give kudos to everyone here who said, this is who generates ideas. Look at how broad your stakeholder community is. Everything from board members to facilitated discussions to partners. Can you begin to see, again, this landscape that says innovation comes from everyone in the room? And I don't know about all of you, but I live on an island that's considered rural, and some of the best ideas I get come from being in Town and Country, our local grocery store, and running into people who either could be a guest speaker or I could get an idea from. So any place and anyone is a place for a great idea. So here we go. How did here's our first example that I want to put up for you. And again, I want to recognize that many of you may already use some of these tools or may in fact be one of the networks that I've chosen to share their story about. But if you haven't, let me just highlight some of these tools for you. So in this particular case, I don't know if all of you have had the privilege of knowing and meeting Tim Sides, who comes from the Rural Wisconsin Healthcare Co-op, of course, in Wisconsin. Tim is the leader of a very seasoned and mature network. He's been very, very involved in rural health issues for many, many years. And one of the last calls that we do in NCHN around, we were talking about how is it that we look at what's needed when so much is needed in rural areas now. And Tim began to share with us a new twist that took place with his check-in. So his board met, as they always do, and in Wisconsin, they're fortunate enough that people invest the time to travel. And so he hosts face-to-face meetings, and I've had a chance to be in one of his board meetings before. So consider 20 to 25 hospital executives coming together for a co-op board meeting. And as they were doing a round table, usually kind of giving updates on what was happening in their community and what was happening uniquely in the community, one of the members very quickly mentioned, oh, we're seeing an increase in heroin use in our community, and went on to give some additional updates. Well, just that one statement, and I believe I'm giving the sequence of events as Tim shared them with us, just that one comment opened up others saying, oh, you know, we're dealing with the same situation in our emergency rooms, and we don't exactly know how to handle it. So from that conversation of a hospital CEO checking in at a co-op board meeting came this connecting of dots from those folks who had discovered that there had been one incident or several of these incidents of heroin in their community hospitals. And in that discovery came a commitment to innovate. Now, they may not have called it a commitment to innovate, but what they called for was an action, let's move from saying, we have this issue and problem, to saying, what are possible ways to address this? What are promising practices that work for our particular network? So I won't go into all the details, but other than to say, how did they discover? The discovery might first come from just conversations and check-ins that most of you support with your boards and have as the first agenda item on any board meeting. If you go to that particular website, the Rural Wisconsin Health Co-op, if any of you are interested, there are some very interesting policy papers on this. And also there's just a tremendous PowerPoint and talk from one of the hospital administrators as they put in place actions that they can take for this situation. So there's 2 points here. One is conversation lends itself to innovation and gives ideas that may or may not have been explored before. And 2, a very pragmatic tool is to know which of your colleagues leading networks might be dealing with a similar issue and begin to pull best and promising practices and share best and promising practices. So you can see from this crazy arrow here that I think as Amanda, I want to give the kind of go back to who gives these ideas, that everyone gives these ideas. Everyone is able to contribute to best practices, and everyone then reaps the reward when things are implemented. So let's move on to the next. What is innovation? And I probably don't need to tell all of you, Cassie was good enough and Becky was good, were both good enough to share with me who might be on the phone today and a little bit about the work that you've been doing over the past several years. And so I know and know some of you that you have been looking at your communities through the eyes of someone willing to invest in innovation. It's looking at members of the community as customers, and a lot of times we don't use this particular word, but the truth of the matter is there's something in stewardship about calling members of our community customers. It means that they're looking for something that we can provide. There's a value that we share together. Our members of community, our members of board, those individuals who may be receiving our services. So there's something about shared stewardship that happens when we begin to look at our communities as full of potential customers willing to get these innovative practices. Innovation is looking at a situation through the eyes of our customers. And that can be just a really fascinating experience to take a look at. I often, when I'm teaching, when we talk about who's in our communities and who might be the recipient of some innovation, I often have the students literally take off their shoes, because often, I don't know about you, but I'm in experiences where we talk about someone who's going to get the service instead of having them in the room. And so we literally will step into the shoes of someone, for example, needing mental health services. Or we'll literally take off our shoes and step into the shoes of someone needing affordable and safe housing in rural areas. And so what does it mean to literally step in the shoes of? So innovation is all about the value proposition of what's needed, what is possible to give, and how do we innovatively create that. So I want to pause there and say, any questions? Are we doing, I miss seeing your faces. I wish we were in a Wisconsin board meeting where I could see how all of you are tracking. Any questions from here? Okay, hearing none, we'll move on. I love this particular slide because there's often a sense that innovation comes from only creative sessions and only comes from brainstorming. And in fact, it really comes from planning. It comes from strategic thinking and strategic implementation. And later on in this slide, we have a couple of resources that we'll share with everyone, and you may also have resources around creativity and innovation that you want to tuck in here, because often the two go together hand in hand. But the truth of the matter is, when your board or your advisory group, or when the individuals working within a network to allow it to thrive and survive come together and begin to decide what needs are existing in the communities being served, what needs to definitely happen after the brainstorming is literally this analysis of both who would receive these services, so that's one arm, or who might need these. The second step of this is research. What has been tried before? What worked well? And then you can ask the kind of the flip side of that, what would we never do again? Often that's left out of innovative thinking, and that's really a key question to pose, because when you hear that question, you begin to see, oh, it's a bandwidth issue, or oh, that's already being provided by someone else in the community, and we don't need to duplicate a service. So that question about what would we not do, what would we do, are two really great sides of one coin to ask. And then you begin to build your strategy. And strategy and strategic thinking really begin to move us to this part of innovation that's all around sustainability, traction, and being able to evaluate when we're really landing on success. So I want to put a pause here and just tell you about one of the really innovative networks from this perspective of banners. So if any of you have had a chance to go on a website called Medisota, M-E-D-I-S-O-T-A, and is anyone on there from the Medisota network? I want to tell you, this is a network. Their website is a network of living innovation. If you have a chance, jump on their website, because they have this very unique and great banner that runs across, so you have plenty of time to read it, but what it does is highlight what's happening with some of their 20-some hospitals or their members of their organization. And they talk about so-and-so is just got an award in this area, or so-and-so is just implementing this process. So if you go on their website, you begin to see this banner of where innovation is popping all over their entire service area. And it's one of the best places to go to say, if I'm interested in this particular element of, say, mental health services, I could contact someone through the network and begin to get, what are some promising practices going on there? So leveraging your website or leveraging an agenda that goes out to highlight a best and promising practice is a second tool to begin to breed this culture of innovation. So I'm going to guess no one from Medisota is on this particular call, but kudos to them for building a culture of innovation online. Let's move on and talk about another step in innovation. And this is sometimes, and not always, but I just want to be very transparent here again and say sometimes when we're looking at new services in a network, this is the place where often people get weary. So I just want to give you that alert. It's hard to be that fish leaping out of one fishing bowl or one bowl and into another, isn't it? I mean, this graphic kind of says, when you have a great idea, taking it from the brainstorming part to the part where it really is implemented really takes iteration, integration, and inspiration. I'll also give you a fact or a factoid. I don't know that it has any research behind it, of asking this question. When you think about new ideas and when you've tried new ideas in your network, about how many months does it take to go from inspiration and brainstorming to actually implementing this good idea? Just go ahead and use the chat box again. How many months does it take from a great idea to a great landing? where it really has been accepted and you've implemented it in the community? Great. With that, I'm anxious to see these numbers. How many months does it take to move from this? Oh, that's great. It takes years. Can be 3 to 18 months. Great. Okay. 3 months to plan, but oh, perfect. So this is this tool at this place right here, this iteration, integration, and inspiration is exactly where as network leaders and as board members and as clients or customers about to receive services, this is where we all need to kind of roll up our sleeves and go, yes, this is where the rubber meets the road, and this is where we really need to have great planning, great attention, and great intention, because moving inspiration to literal actions really takes courage and tenacity. So I'll stop on that, and I bet that if we were all together at a conference or sharing lunch together, we'd have some wonderful stories, including stories of pivots when you least expected it and you suddenly found yourself going 180 degrees in a different direction than what you originally intended. That's all part of the planning process. So that gives you a thought about moving from and creating this culture of innovation. It's culture that takes time to build. It's culture that takes time to sustain. And it's culture that really leads to phenomenal results. So let's talk about what an innovation ecosystem looks like. And yes, this is a picture from our island here outside of Seattle over to Seattle. It's about a 35-minute ferry ride. But this ecosystem here reminds me of what a network ecosystem looks like. And I'd ask you these questions. When you look at this, what kind of stakeholders, and I know I'm kind of asking you to bring your imagination and your aspirational thinking to this, but when you look at this, what stakeholders do you see? So when we're in building this model of inquiry and innovation, a culture of innovation, who are the stakeholders we really need to have involved? So again, if you don't mind, just jumping into that chat box. We've talked about who contributes to innovation. We've talked about how long it takes. Now let's talk about who are some of our stakeholders. And I kind of look at that log there. I'll kind of get you started before you jump into the chat box. When I look at this picture and I think about who are my key stakeholders when I'm building culture into some of the networks that I have had the privilege of working with or working with now, can you see that log in the middle that's kind of turned upside down and upright? I look at that as the innovation that actually takes place from one of our major funding sources, and that's HRSA. They innovate. They look at how they offer grants. They take best practices, and they begin to look at what's possible for funding that moves the bar up on this culture of innovation. So I look at that log as a stakeholder of funding. Could be a local chamber of commerce that's offering seed grants. So just for a moment, who are the stakeholders that are so important that we need to have as we move into this culture of innovation? Go ahead and add them in the chat box. And again, I hope I see that a network leader is in here. Because clearly you're such a part of this ecosystem. You can choose to be the water, the land, the biking path, but I truly think network leaders while you're typing in here. Consumers, great. I'm just curious, who do you see, Jackie, as the consumer in this ecosystem here? I have my perspective, but I'd love to hear yours. Great. Who are the perfect, Leah? Great. can you begin to see, and I don't need to tell you, but sometimes for me it's important to be reminded that we have all these multiple stakeholders. And if I look at, as Jackie said, the consumer out here, I kind of see that as the water. There are consumers out there that, as network leaders, we touch, some that we haven't yet had an understanding of what they might value from the network, and it might be to be a volunteer. We don't really know. That customer base out there in our communities is large, extensive, and really often an untapped resource for innovation. Great. Anyone else want to jump in and say, when I look at this whole innovative ecosystem, here are some key stakeholders? Okay, great. So these are just some ideas about why innovation is so important, and I want to take you to Vermont at this point. You can kind of see that we're doing a virtual transfer all over the United States in the short time that we're together. But I want to take you to Vermont Care Partners. If we go back to this ecosystem, many of us have created partnerships. That's how work gets done in networks, of course. That's the very kind of the lifeblood of how work is done and funding takes place. There's collaboration, there's sharing of resources, there's sharing of staff. In Vermont Care Partners, I'm really have really been impressed with the partnerships that they have created. Number one, it's a partnership that started, kind of back in the early 90s, and it was a collaboration between the Vermont Council and the Vermont Care Network. So two kind of large collaborative bodies pulled together, and you can go on their website and see the services they're providing, much like the network we talked about earlier in Wisconsin. They're really looking at, from a policy perspective, what causes the issues that we see? What are possible solutions to some of the conundrums that we face in our unique communities? But what is so fascinating to me when we look and think about an ecosystem and this next question of why is innovation so important is that they pull together a partnership of the police and the network and the individuals being served from a mental health perspective. So as many of you mentioned, the patients, the providers, the government, local government, state, federal government, in the Vermont Care Partners, they've pulled together some very unique partnerships and collaborations of the not so usual suspects that we pull together in networks. And they've supported that, by the way, in their state, as many of you do, through technology, gathering information on needs, really having conversations with all of these unique partners of what's needed, what's been done in various precincts and areas throughout Vermont, and what could be done. So there's just a very, very inclusive nature and a creative approach to who might they partner with. And just again, on this particular slide, you can look at why is innovation so important. I don't know about all of you, but when there's creativity and when that creativity moves to inspiration and then implementation, work is interesting. The value proposition of the network is interesting, and this contributes to the ongoing sustainability and services that a network can provide and our customers, our stakeholders can receive. So I won't spend more time there, but just to say there are so many ways that you can begin to connect the dots in your network ecosystem that might surprise you and bring in new voices and new perspectives. And I can hear some of you saying, but we have so many great ideas. How is it that we choose the right one? Well, that's the work of your advisory group. That's the work of you. And I don't mean to be light about it, but sometimes great innovative ideas mean that you put something on hold that you were doing in order to take on something new that perhaps is more relevant. And it's really important as network leaders to keep this in mind based on what we just talked about in the chat box, how long it takes to go from inspiration and brainstorming to actually implementation. So as we move along and we talk about how do we really determine what we need to do and what's really important, there's a really quick tool that you can use within your meetings of decision makers, and those decision makers can be community-based, they can be discipline-based, like your pharmacists coming together to look at what's facing them and what's facing services within hospitals or clinics, but very much on a board, or advisory group member, a meeting, you can begin to say your goal in the middle is X. So the goal might be to develop partnerships, as we just talked about in Vermont, with key stakeholders, often facing patients or individuals in the community with mental health needs. How do you pull together expert mental health providers with police who are faced at often the first contact? So that becomes your goal in the middle. Usually it's an inquiry. How do we serve these customers or these individuals needing this service? Then, and you can begin as you're leading your discussion about should we do this or should we not, and what does it mean, to do a really quick strengths, weaknesses, opportunities, and threats. I don't mean to say that you do this lightly, but often as you begin to say what would allow us to move forward, this is a tool that you can use initially, in the middle, and again at the end when you're developing metrics for your service. So we're beginning to see some tools emerge in here as well that you use with your networks. The second tool, or the third tool actually, because we've talked about the whole brainstorming and we talked about how do you assess the brainstorming. Brainstorming, again, let me just flip back to this strengths, weaknesses, opportunities, and threats. And if we had a few minutes here, I'd actually have you take one of the last innovative ideas that came out of your decision-making group and just play with these 4 quadrants if you haven't had a chance to. Just take 5 minutes and say, of this idea, what are the strengths of this idea? Where are the threats? But that's just a quick tool that you may want to keep handy as you move into decision-making meetings. And then once you begin to identify and move to implementation of an innovative idea, how do you begin to give it stability and give it traction? Well, there's 3 ways to do that. First is through extensive communication. And I don't know about you, but often network leaders are often faced with multiple and sometimes conflicting priorities. And so engaging your advisory group or your decision-making group on saying, yes, we're going to do this, and then talking about how will we keep each other updated? What reports and what updates will we give on a regular basis? This extensive communication is so important because many of our key stakeholders in that ecosystem that we talked about, they have a day job. And so reorienting and really saying, here's where we were at the last meeting, here are some of the things we considered, here's what we agreed to, and here's where we're going. You may think that you've said that 3 times and they should have it, but the truth of the matter is we need to keep that extensive communication going all the time. For a creative climate, this one is really interesting because it means that your network and everyone participating in your network is willing to do 2 exercises. The first exercise is to say yes or maybe, but to articulate where they are. The second is to be willing to take risks. We're going to try this. We're going to do a pilot. I agree in my hospital that we're going to take this on as a pilot on behalf of everyone else. So the ability to weigh in creates or contributes to a creative climate, and the willingness to be a pilot so that you can have some risk and see what works and what doesn't. And the third, of course, is what can we learn from these pilots, and continuing to build this learning base. And I know many of you do that already, but those are three follow-up tools that you need to do once you've looked at your stakeholders, engaged them, and then you're willing to put something that's innovative in place. And then the last, as we begin to wrap up, the last thing that we talk about is in innovation, a leader's needed. And sometimes that leader is a leader of a subgroup. Sometimes it's the someone on your advisory group that's willing to take this on, and many times it's the network leader. So here are just some, what's needed in leadership, and I just want to pause here a moment that as leaders that are working on so many initiatives, reporting on the status of a grant, for example, or moving a project forward, or hosting board meetings, or igniting some strategic thinking for the next year. What have we missed on this list of what's needed in leadership? We've talked about how do we agree to work together. We've talked about resiliency. We've talked about, piloting. And I've added about what's needed in leadership, and again, maybe this is because I've seen it in the network leaders that I've had the privilege of working with. They all have this astounding sense of humor. What else are we missing here about what's needed in leadership? Anything that you want to add to this slide as we think about building this culture of innovation? Just pretty much gather it. Nice. Yeah, that's very different than resiliency. Nice. I like flexibility. Good. That fearlessness, Suzanne, isn't that really, you kind of want to give sometimes a small gift to someone and say, here's a fearless rock. Go ahead and try it. Openness to other suggestions. Yes. And especially, Joan, I don't know if this is what you mean, but it often strikes me in innovation, we get this great idea in our head, and then someone wants to tweak it a bit. So beautiful. That's an excellent addition to this, what's needed in leadership. This is a really important slide, so I want to pause here. Creating this culture of innovation really takes a concerted effort, as you can tell. There are tools, there are examples, but this suggestion that Leah's making here of ensuring that all voices are heard, as we talked earlier, when you have some folks on your advisory group or in community action forums who are more quiet, it's important to give time for their voices and their thoughts to emerge. And then it's important, as Regina has here, to allow all of the thoughts that are swirling around to move into this connecting the dots and collaboration. Collaboration doesn't mean everyone agrees, but collaboration goes back to this public agreement, and that we can agree to consider ideas. Good. Well, I would just